My name is Tim Hague Sr. I'm a speaker, author. I have Parkinson's disease, and I am a PD Avenger. More to that point in just a moment, but welcome to Coffee with Tim, a conversation of life and Parkinson's. One thing I need to throw in today is that I am also a retired registered nurse, because we're going to be discussing some things this morning with Dr. Soania Mathur in a program I'm titling today, Dr. Mathur and Nurse Tim. I'm quite interested to have this conversation with Dr. Mathur, a friend and colleague, and we're going to discuss mild cognitive impairment. So I hope you're doing well wherever you're at. Make sure that if you are on YouTube, that you hit that subscribe button. Let me know that you are here with us. Give us a thumbs up on Facebook. Tell us how we're doing. All of those things help me in spreading the word about Coffee with Tim and getting this information to more and more people around the world living with Parkinson's disease. So if you could do those things for me, it'd be great. If you are on either of those channels, make sure that you say hello in the chat below. I will do my best to respond and answer questions as we go along. And Abe and Betty, good morning. You're quick on the draw this morning, guys. Good to see you. Hope you're surviving. I am hailing to you from Winnipeg, Manitoba, Canada. If you don't know that already, it's right smack in the middle of Canada. We are one of, if not the coldest, generally large city in the world. Yes, in the world. So to give you an idea of what that pans out to be, this morning I woke up to minus 32 degrees Celsius with a wind chill of about 45, minus 45 that is, Celsius. No matter whether you're thinking Celsius or Fahrenheit, folks, that is damn cold. And so all I say is that, people ask me why I live here. I say it's taught me perseverance, and I get to brag. Only the strong live in Manitoba during these temperatures. That's what's made us famous, and we just embrace it and go with it. Well, let's find Dr. Mathur. Let's talk about mild cognitive impairment. Good morning, Soania.
Good morning, Tim.
Welcome to Coffee with Tim.
Thank you.
Do you have your coffee?
I have my coffee, and I have my hat. For part of it anyway, as long as I can tolerate it.
Nice.
Can't come to Coffee with Tim without a hat.
Absolutely. Well done. I appreciate it. Hats have become my thing on Coffee with Tim.
I know. I've watched. I know.
I typically haven't worn hats out. I have lots of hats. It's a bit of a disconnect with me for some reason. I have lots of hats. I have probably 15 hats in the house. Right. I would rarely wear them out.
Right.
I wouldn't wear them speaking and whatnot. But one day when I started this, I threw on a hat. I got lots of comments, and so now it's a thing.
It's your thing now.
It's my thing. And the fact that I'm balding, my wife says I can't cut my hair all off, so I just go with the hats.
Oh, there you go.
She likes the hats.
There you go.
Well, good morning, Chuck. Good to see you. Dorothy, good morning. It's cold there in London, Ontario as well, but not as cold in Winnipeg. No, nobody's as cold as Winnipeg. And Dorothy says, good morning, Dr. Mathur.
Hi, Dorothy.
Dorothy Gillies, I believe is how you would say it.
Nice to see you, hear you.
All right. Well, let's get on with this discussion of mild cognitive impairment.
Nice.
This is something that I was diagnosed with a while back, and so it's been a reluctant interest of mine. I got diagnosed with it when I went to sign up for a trial. Yeah. And to get into the trial, I had to pass or fail, if you will, the test for mild cognitive impairment. So I passed to get into the trial by failing the test that they gave me.
Right.
Which resulted in me being diagnosed with mild cognitive impairment. And like most things with Parkinson's disease, we tend to walk into these things, get smacked with it, walk out not really understanding what's happened.
Yeah.
So since then, I have done some research and whatnot, but I thought, you know what, today would be a great day to start this little, what I hope will become a regular part of my show, Dr. Mathur and Nurse Tim discussing this issue of mild cognitive impairment because you don't hear about it often. And it sounds like when I first heard it, I said mild cognitive impairment, cognitive brain thinking impairment inability. And it scared the crap out of me. And I thought, well, does this mean I'm going to lose my mind? What does this mean? Yeah. So, is that what it means, Sonia? No. Now, is it okay if I call you Sonia, or would you prefer Dr. Mathur?
I would be upset if you didn't call me Sonia. Yeah, no, no, it's not a sentence to disability. Mild cognitive impairment is actually quite common in. If you look even at early people with an early Parkinson's diagnosis, meaning early in their disease, 10 to 20% develop mild cognitive impairment early on. 15 to 20 years into our diagnosis, when we're older onset, the majority of people will have some degree of mild cognitive impairment. If I looked at one study, says YOPD people have about almost 45% mild cognitive impairment. So it's very common. It's very common. We have to also remember that it's common in the general population. I mean, if you take 85 to 90-year-olds in the general population, the majority have some sort of cognitive issue. So it's an age-related thing as well.
Okay, so how do I know that what I was diagnosed as mild cognitive impairment isn't just me at 56 years old? I know that's ancient for you, but
not that much.
How do I know that at 56 years old, I'm just not, older, starting to lose my memory and some of those faculties as a normal progression of life?
You're absolutely right. And it's very difficult to say, but we compare you to other people in your age cohort. So someone with mild cognitive impairment would have worsening cognitive issues compared to someone at the same age that didn't have Parkinson's, for instance.
Okay.
And I guess you have to talk about what cognitive decline actually is, right? And it's an impairment in three basic areas: your memory, the speed you process information, and your executive functioning, which is things like planning and organizing and multitasking and problem solving, that sort of thing. So if you're worse in those areas compared to other people your age, then that would be a cognitive impairment.
Okay. All right. Let's hold that thought.
Yeah.
Because with that thought of loss of memory and organization, I didn't properly introduce you.
I didn't notice.
I've got my notes in front of me, and I managed to skip through a whole 2 paragraphs. So let's just back up 1 second. I want everybody to know exactly who you are. Sonia's lived with Parkinson's for over 20 years now. She was diagnosed at 27. She had just began her career as a family physician. Now she dedicates herself to doing things like this, education and advocacy work on behalf of Parkinson's. She's a speaker like myself. We've had the opportunity to be at multiple events together, and that's always fun. She has authored 2 children's books, 2, correct?
2, yeah.
On PD, and they are available on Amazon as well as through her website, Unshakable MD. She has worked she continues to be involved with organizations like the Michael J. Fox Foundation, the Davis Finney Foundation, the Brian Grant Foundation. And by happenstance, she just happens to be one of the 3 founding members of the PD Avengers, along with Larry Gifford and myself. And that's awesome. So, Sonia, before we get back to mild cognitive impairment, give us just a little blurb on why the PD Avengers.
Why the PD Avengers? Well, it's basically to address the problem of the fragmentation of the Parkinson's community in terms of trying to unite the Parkinson's community globally. We want to address the fact that, Parkinson's disease was classified over 200 years ago. The gold standard treatment that we have for Parkinson's disease, or dopamine replacement, has been there for over 50 years. Why is that? Why is that when mankind has, solved things like polio and HIV is no longer a death sentence? We're tired of the fact that Parkinson's disease seems to have taken a back burner. It's not in people's consciousness. It's not addressed the way it should be addressed. And so the PD Avengers came together to form that global alliance of Parkinson's. The Parkinson's community can be patients, care partners, or neuroscientists, researchers, friends and family, whoever cares about Parkinson's disease and wants to make Parkinson's disease an issue that needs to be addressed and solved. So we want to end basically Parkinson's disease.
Yeah. Awesome. Well, you know, and everybody here that's followed me for any amount of time knows that I am a huge fan of the PD Avengers. And I was looking through our numbers the other day, and I'm sending this word out to all my Manitobans now. There's not nearly as many Manitobans signed up to be PD Avengers as there should be. I need you to go to pdavengers.com, hit the link to sign up, and join us today.
Yeah,
Two things I'm going to promise you. We're not a charity. We're not going to bug you for money. We're not going to spam you, because we are a patient-led organization. And with the topic that we're covering today, MCI, we don't have the capability to spam you because we can't focus that long. But it's also it's our goal not to spam you. You'll get a newsletter once a month, but the goal is to stand together as one voice, seeking to raise 1 million PD Avengers by the end of 2022, so that we can make a change in how this disease is seen and treated.
Absolutely.
So if you would join us today, I would be so very grateful.
And I think that's really important, Tim, to also, put forth the fact that we're not a charity, like you said, and the fact that we want to work with all the existing organizations to help amplify the voice of Parkinson's disease globally, really.
Awesome. Well, thank you for that. Well, good morning, Scott. You noticed that you were having difficulty gathering your thoughts. Yeah, we're going to get into that further. Betty, Rick, good morning. Amy, so good to see you guys. I'm always so encouraged to see so many of the same faces come back week after week. Steve Malone, my buddy out in Ontario, good to see you, buddy. My German Shepherd dog is doing fabulous. 4 months in, she's making me a little crazy, but overall good. Diane, good morning. Kathy Mayhew, good morning. Amy, my friend Amy says hello. Sonia. Jamie Black Shepherd, good morning. And everyone else along the way here. All right, let's go back to MCI.
Sure.
We were talking about that executive function, our memory, and those higher level things that this is something different. If you looked at me compared to another 56-year-old male, how am I handling my executive function, my ability to plan, et cetera, et cetera?
Yeah.
So mild cognitive impairment is something different than just getting older. It's something different than just typical memory loss.
Right.
And I guess we would call it a non-motor symptom of Parkinson's as well, right?
Absolutely.
Those four classic symptoms being tremor, stiffness, loss of balance, and slowness, this falls into something else.
Exactly, because we know Parkinson's is not just a motor disease, right? There's so many non-motor complications that come from it. So, yeah, it would be considered.
And these are the things that people most often run past, right? That they don't readily recognize and understand that this is a normal part of Parkinson's.
They don't readily understand, but sometimes they don't actually want to understand as well. I mean, cognitive issues, like you said at the beginning, can be sort of a anxiety-provoking subject for people with Parkinson's disease.
Kind of up there with mental health in general.
Absolutely.
And so when we stop and think, am I losing my mind? And we have the fear that we're not going to be able to think right. We're not going to be able to control our thoughts. That's our life. It becomes very, very anxiety producing. So let's go back to that discussion we were having a little bit about young onset versus later onset Parkinson's. What are some of the distinguishing characteristics that might set those two apart? Like I'm thinking about things like distraction, disorientation. I find personally with Zoom calls, like the one we were on yesterday, there were like 60 people on that call. This myriad of boxes on my screen, trying to figure out who's talking, who I should be looking at, who I should be listening to. I don't do a whole lot of talking on those because I find that it's very hard to get into the conversation. By the time I figure out who's talking, what they've said, formulate a response,
Mm-hmm.
the conversation's moved on.
Agreed. And that is part of the cognitive dysfunction, right? That sort of speed of processing information is one thing that tends to decline. That ability not only just to process the information quickly, but then to organize and plan what you're going to say is, again, another part of that executive dysfunction. So situations like multiple Zoom calls or in a busy room with lots of external stimuli going on or distractions going on, it is harder to actually accomplish a task if you have any amount of cognitive impairment.
And what about just tasks in general? I can sit down at my desk here some mornings. I can have a to-do list because I've always been a to-do list kind of guy. I can have all my stuff written out. I know what I'm supposed to be doing for the day. I can sit down and 4 hours later get nothing done.
I know that feeling. Yeah.
Does that fall into that same kind of category where I just find it overwhelming some days to figure out what I should do first? And
sure.
if a squirrel runs by my window, I'm gone for 30 minutes.
Yeah, that distractibility is definitely part of it. And the planning and the organizing is, again, part of that executive function issue.
So how about when we're sitting at home with the wife and she's trying to ask us what movie we want to watch tonight? I mean, that drives me insane. It's like, if I don't have a movie in mind that I want to watch, don't ask me.
Don't make me think about it. Was it always like that, though? Or is it just that you don't like to suggest things?
It's been more with Parkinson's.
Yeah.
That it becomes harder and harder to sort through all the options.
Yeah, for sure.
And what's our little saying now? We've got a saying that there's no compound questions after 4 o'clock.
Don't make it complicated. Yeah.
No, it has to be very straightforward.
Right.
All right. So would I be correct in saying that mild cognitive impairment is a slowing of our cognitive or thinking ability rather than a loss of ability?
It is, except for the memory part. But then again, you usually do remember when somebody prompts you. So it's probably more of a slowing. Memory, again, it depends on how you look at it, right? If you can't remember something, but then you remember it when somebody prompts you, is that really a loss of memory, or is it you had a problem retrieving it? So it's probably more of a slowing. And in dementia, though, that changes. When if it progresses to dementia, that's when it changes.
Okay, so what's the chances of MCI progressing to dementia?
We see that in about 25 to 30% of patients, but that's in late onset Parkinson's disease. In young onset Parkinson's disease, it's less than that. It's very uncommon for young onset Parkinson's disease, mild cognitive impairment to proceed to dementia compared to someone with older onset. But in the older onset overall group, about 20 to 35% can progress.
Okay. So I guess there's a couple takeaways here that we want to highlight. Is that one, if you are older onset, that 25 to 30% chance of it progressing to a dementia.
Right.
But even if it's just simple mild cognitive impairment, simple, there's a statement of the day. It's helpful for our partners to just be aware that we may not be just lazy. We may be lazy, but maybe not just lazy.
Right.
That there is a real frustration in being presented with too many options.
Absolutely. Yeah, absolutely. It would be the same as getting frustrated if you couldn't open a jar because of your Parkinson's, right? It's the same thing. It's just easier to visualize a tremor and interfere with your functioning as opposed to something like cognitive impairment.
Okay. All right. Now let's see.
There are also other things other than age, Tim, that can affect your risk for going in the direction of worsening cognitive decline as well.
Okay, what would those fascinating things be?
fascinating. If males tend to have more of a risk factor, things like somebody that has more of a postural issue, like frequent falling or difficulty with balance, gait problems, they're more likely to move into the dementia state. Longer disease duration, definitely. Older onset, as I mentioned. More severe disease, poor response to, say, dopamine replacement, and other comorbid conditions. And comorbid conditions are other conditions that you have along with the Parkinson's. So things like high blood pressure, diabetes, obesity, these sorts of things can also put you at an increased risk for developing dementia and Parkinson's disease.
Wow.
Yeah.
All right. So the point of this conversation this morning isn't to overwhelm anybody.
No.
It's to give you the tools to understand what's going on in life. I mean, this particular topic has stressed me out over time because I didn't understand it.
Right.
And for me, the more I understand something, the better I deal with it.
Right.
And so that's the point here this morning, is to help you understand this piece.
Yeah, education is power, really.
Yeah.
Right. And when we talk about those risk factors, there are certain risk factors that we can do something about. You know, if you have high blood pressure or diabetes or obesity, then getting good primary care to address those issues is really helpful for you in terms of reducing that risk factor. Exercise, we know, is good for you. And that can also,
right out of my mouth.
that can also help you reduce a risk factor for cognitive issues. So education is power. And then you look at those things and you think, okay, what do I have control over? What are my variables here that I can control? And then you go after those in an active way and actively manage those issues so that you can help reduce your risk.
Yeah. And all of us can exercise. I know some of you will respond negatively to that statement, but all of us can exercise. There's something we can get out and do. And science shows us, science has proven beyond a shadow of a doubt that anything that we do will be helpful to us in the short term and the long term in helping to control the symptoms of this disease. It may not stop the disease, it may not roll it back, but it will certainly impact your symptoms and how you feel day to day with this disease.
Absolutely.
And I know some of you will say, but Tim, I started exercising after 20 years and I felt like crap. No kidding, you sat on your butt for 20 years. What do you think your body's gonna do? Even if you didn't have Parkinson's, it's gonna hurt.
Absolutely.
It's gonna take a little bit to get past it, but you gotta spend some time, stay focused, stay on task, and it will serve you well in the long haul.
And it doesn't have to be a long time, Tim. I mean, as long as you can get your heart rate up for, say, 4 or 5 times a week for half an hour, that's what's good for you.
All right, so we're saying that there's no guarantee that mild cognitive impairment is going to turn into dementia.
Yeah.
We're not going to suddenly pop up with Alzheimer's.
No.
There's not, just because I've been given a diagnosis of MCI doesn't mean those things.
Absolutely not.
There is a risk. There's a risk I can get run over by a bus today too. Absolutely. But these are the risks that we live with, and we inform ourselves and we live better because of it.
Exactly. Yeah.
So if we're concerned, if hubby, if wife, if grandpa, if grandma is suddenly acting weird, is not remembering things, is clearly not as tight as they once were, and we're genuinely concerned, what do we do?
Well, you go see your doctor. and because there's also other things that can cause grandma or grandpa or your husband or wife to act differently. And I mean medical conditions, right? Yeah. There's certain medications that they can be on that might be causing confusion that needs to be addressed by your physician. There's also other things like strokes and other medical issues that might be causing confusion, not just necessarily Parkinson's disease. As I said, certain medications like common things like Benadryl can cause confusion. That's an anticholinergic. Pain medications like narcotics can, benzodiazepines, which we use often for sleep or anxiety, can as well. So there's lots of things that need to be looked at by the physician to make sure there's nothing else that can be reversed that can improve somebody's cognition. So going to see them and also diagnosing. Sometimes it's just normal, natural aging, right? But if they're, so they'll probably, do something like the MoCA, the Montreal Cognitive Assessment test, or or they'll use some sort of formal measurement scale to see what's going on.
They'll have you drawing pictures and drawing lines and all kinds of goofy little things that you'll wonder, what in the world is this all about?
Yeah.
Drawing a clock and all kinds of fun stuff.
Yeah.
The important takeaway is that there is often something that can be done to help you in these moments. If at the very least, giving you further empowerment through knowledge to know how to respond. But oftentimes there are things that are causing memory problems that can be addressed.
Right.
And that can be helped. So go see your physician. Do not take the words of just a retired nurse, not just but a retired nurse and a physician who doesn't know you. You
yes, no, you have to.
Don't be on this conversation.
Yeah, if you're on any of those medications that I mentioned, don't stop them until you see your physician and get their medical advice, because every person is different. Everybody has different conditions that are, along with their Parkinson's, have different reactions to medication. So I would never say do anything about the medications yourself. You have to see your physician.
Yeah, make sure you see your doc.
Yeah. And
you would break our hearts if you made any decision without their input that was not helpful to you.
Oh yeah, no. I would never suggest that.
No. I just don't want anyone to take that away.
Yeah, absolutely. Good point.
All right. I'm going to put into the notes for you later a article that I run across in Parkinson's.org, Parkinson's Foundation. That is, I just find it a great article discussing cognitive changes with Parkinson's disease. I'd encourage you to go to places like the Michael J. Fox Foundation, Davis Finney Foundation, Brian Grant. Lots of good information out there around cognitive disorders of lots of kinds in Parkinson's, and to arm yourselves with good knowledge. I'm sure there are other places that you can go to find good information, possibly local organizations that you work with, but those that I mentioned can be trusted. They will give you straight shooting, honest, good information. And so I would commend them to you. Well, Sonia, thank you very much for joining me today. Is there anything that you'd like to leave us with on this topic?
No, I thank you for having me. I really appreciate the opportunity. I think you're absolutely right. Education is power in this disease, and optimism for the future. There are things that we can do to improve our life condition. There are things that we can do to optimize our quality of life. We just have to identify those things and then move forward. And conversations like this and all the work that you do, Tim, helps people live their better life, and that's what's important.
Well, thank you. Thank you for being on. If they say they like us, we'll come back and do another episode of Dr. Soania and Nurse Tim one day, and hopefully not too far in the future.
That'd be fun.
Have a great day.
Take care. Bye.
Well, guys, there we go. First episode of Dr. Mathur and Nurse Tim. I liked it. Tell me what you thought about it. If you liked it, we'll do it again sometime. And let me know what kind of topics that you would like to hear us discuss. If you have questions about specific things, we'd be more than happy to attempt to address those. So I want to leave you with, especially if you're here in Manitoba, April 24th, you need to mark your calendars for our first annual Parade for Parkinson's. This year it will be virtual, of course. COVID, our friend, not relenting just yet. But our Parade for Parkinson's is going to be a two-pronged event. Number one, it's a celebration. We are this April 16th, or April 5th, actually. We will be 5 years old. U-Turn Parkinson's offering wellness programming here in Manitoba, offering rock steady boxing, yoga, U-Tunes, a singing group, various speech therapy exercises. We have a speech therapist on staff, and a variety of things to help people living with Parkinson's live their best. So we're going to be celebrating our 5th anniversary as well as doing our first walk. So we'd invite you to come walk with us, stroll, wheel, and celebrate our first annual Parade for Parkinson's together. You can get more information on it at uturnpd.org. I'd be thrilled if you'd go sign up, join us to be a part of the parade. And if you don't live locally and just love me or love U-Turn Parkinson's, I want to make a donation, that'd be great too. So we're looking at expanding our facilities this year, hiring an executive director, and we're doing something that we have sought to do for 5 years, remove all the fees from our programming so that we're able to offer our programming for free to anyone who wants to come, so that regardless of their financial circumstances, they're able to access the many programs that we offer people here in Manitoba. So that's what we're doing this April. So go to uturnparkinsons.org, check it out, sign up, make a donation if you're so inclined. And thanks for tuning in today. It is always my pleasure. And, it's a great time for me to do these. I feel like it's a great opportunity to be Mr. Nurse in some small way. So I appreciate you showing up every week. And until next week, hug those you love, live your best, and always persevere, because you know that this race, your race, can be won as well. Have a great week, guys, and we'll see you next week. Bye-bye.